Hi, my name is Mariah. I'm a student nurse from Southwest Tech. I have a doctor's order here today to do your parenteral medication administration. The first one I'm going to do is the intradermal, and that would be your TB test. Can I have you state your name and your birth date for me? Okay, Joseph Smith. And then can I have you date, so your birth date is 10/5/1953, and then do you have any allergies? Okay, sulfa. And then when I would come in, I would provide privacy by closing the curtain, and then um, wash my hands and put gloves on. I'll put gloves on when I start to do the administration for this. So then, let's see here. So it looks like the doctor order says that I need, for the TB, it is 0.1 milliliters, and I need it for the tuberculin purified protein. Okay, and then so then I will talk about my med. I have the tuberculin purified protein. It causes a hypersensitivity reaction in the patient, synthesized by the myocardia bacteria infection. Side effects would be allergic reactions, neurosis, vesticulation, pruritus at the site of infection. The test is used to determine if someone has active TB. They would come back in 2 to 3 days to get it checked again, to see if there's a firm bump, and if there isn't, it's a negative. And then, but if there was a positive, they'd have to get X-rays to their lungs. And then there isn't any labs for this. You would generally do a 0.1 milliliter amount would be your dose, about a 5-degree angle. You want it about level with your arm or your chest or possibly your upper back. You could do it in. It's a 28 to 26 gauge needle. And then when I start, it's here, I would be checking my medication with my doctor's order here. So then I would make sure that I have my tuberculin purified protein here. And that'll be my first check, and I would check it on my doctor's order. Okay. And then as I'm checking this, I would be checking the bottle to see if it is intact, if the cap isn't off. I would also be checking my syringe, that it would be sealed properly, that there is an expiration date, that I have the right size of syringe, right gauge, which this one here is a 27.5 gauge, so which that is okay because it's in the 26 to 28 gauge range. So then to start off with, I will be applying my gloves. And then I will clean off my bottle, my solutions, for 30 seconds. Make sure that it's sterile. And I'll dispose of that, and then I will also clean off my site that I'm going to use for 30 seconds. And then I will be, I'm going to do my second check, and then I won't be using this container because I don't want to, I want to keep my solution sterilized, so I got my bowl of water here. I'm going to do my second check on my medication. Okay, so it says tuberculin purified protein, and that is correct. And then I have my 27.5 gauge needle here, and it's all intact. I will sit here and I will open it, and then I'm going to draw back 0.1 1 um, milliliters of air, and then I will take off my cap. I would push it back into the bottle, and then I am going to draw back 0.1 milliliters of solution, and then I would do, let's see, I'm going to do my 5 um, rolls of medication, right route, right person, right dose, right medication, and right time. And I would do my 3rd check to make sure that it's the tuberculin purified protein. And then I will be, so once make sure my area is dried, I would put the bevel up so that it makes a bleb, and I would put it in about level with the skin, or 5-degree angle. And then I want a bleb to come up when I do that. Okay, and then I would put the safety on my needle and dispose of it in the sharps container. And then, I don't know if you can see it or not, but I got a little bleb there in my hot dog here. And then I would probably put like a band-aid over the top of it. I would explain to the client that they need to come back in 2 to 3 days so that we can check it and make sure that there isn't any rash or a bump from a positive reaction of it. And then I would document this in my charts. Okay, so I'm back here again with Joseph. Hi Joseph, I have come here to be giving you your insulin, your subcutaneous injection. To start off with, I would have come in and checked his blood sugar levels, which his would have been about 320 when I checked it. So that means I'm going to have to be giving him, when I check the MAR here, 10 units of insulin. So to start off with, I'm going to wash my hands, and then I'm going to apply my gloves. I will check my packaging to make sure everything is sealed. So then if I had my, I would have my Novolog here. So I would check to make sure that my insulin container is sealed. I would clean the top of it for 30 seconds. I would also be checking if it was the correct expiration date. And that would be my first check. And I would also be, during my first check, I would be checking it with the MAR to make sure that I have the correct medication here. And then I'll be checking my insulin syringe. It's a 100 unit insulin, which I only need 10 units. I'll be making sure that the package is sealed, that it's not expired. Make sure that I have the correct gauge here, which 29 gauge, which for insulin you would use a very small gauged needle. And then I will be cleaning my site here on my orange, which you would generally do this in your subcutaneous areas, which would be like your stomach, the back part of your arm here, any like fatty areas. There, you can also do it in your leg too, which it's good to be switching different spots as you're doing this, because it could start to get really sore as you're doing this. I'm going to talk about my insulin. It's an anti-diabetic. This one here, the Novolog, is a rapid-acting one. It lowers the blood glucose by stimulating the glucose uptake in the skeletal muscle and fat. It inhibits hepatic glucose production. Symptoms, you would look, or for your assessment, you would be looking for symptoms of hypoglycemia. And then labs, it may cause a decrease in the phosphate, magnesium, and potassium levels. Side effects would be swelling, arrhythmia. Serious ones would be hypoglycemia or anaphylaxis. Okay, so I'll be doing my second check, so I'd be making sure that I have my Novolog here. And then I can take out my needle. And I would draw back to the 10 units here, and then so I'm going to again keep my solution sterile, so I'll be going back into my water here, and I would push the air back into the bottle and draw back my 10 units, and then I would do my second check of my solution, make sure that I have 10 units and then it's Novolog. And with these type of drugs that are very high alert, I would have a second nurse come check to make sure that I have the right amount in here and the right medication here before I would administrate it. And then I will do my 5 rights again, which is right route, right dose, right person, right medication, and right time. And then I would do my third check with to make sure that I have my Novolog here. And since that I'm giving them the 320 was their blood glucose level, I'm giving them 10 units. And then when I give this, after I clean the site, I would do it in a 45 to 90 degree angle, depending if it's a heavier person. If there's more fat, you can go ahead and give it right at a 90. I would pinch up the fat and then insert the syringe directly in and then push it right in. I would hold it for about 10 seconds so that it didn't come back out up the body, and I would hold the syringe up, and then I would put my safety on. I'd probably put some gauze over it to hold it there for a little bit. I would dispose of this into my sharps container, document what I put in my the insulin that I put in. So next I'll be doing my IM injection. I'm going to start with my sites here. So my ventrogluteal, I would put my hand here on the okay, so I put my hand here. I'd have my pointer finger facing the anterior superior iliac crest, or the other ones are back in the iliac crest, and I would do my injection site right in here. I would clean it off when I would do that. My next spot is the vastus lateralis, so I would put one hand on the greater trochanter, the other one on the thigh just below the knee, and about a third of the way through would be my injection site, and I would come off to the side and I would put it right about into here. My third injection site would be on the deltoid, which okay. Then I would put my pinky on the acromion process, here, and I would line it up with my axillary line and have this little triangle here from that. And I would do about 4 fingers down, and then my injection site would be right in through here. Okay, so then before I would start, I would check my doctor's order. I would be asking the patient their level of pain, if it's according to the MAR, if it was a higher dose pain, I would be doing my Troadol, which that would be your severe pain, while your Demerol would be your pain that's rated at a 5 to a 10. I would do my check. I'm going to go over my Toradol, which is a non-opioid analgesic. It decreases the pain, inhibits the proglastin synthesis, and then I would look for signs of allergic reaction, look out for a rash. Labs would be your liver function test, AST or ALT. It may increase. Side effects are drowsiness and anaphylaxis. Serious side effects would be stroke, myocardial infarction, GI bleeding, Stevens-Johnson syndrome, exfoliative dermatitis, toxic epidermal necrosis. And then for my Demerol, that's an opioid, so when I would do that, I would be doing my check with another nurse, because it is a high-risk drug. And then it binds with the opiate receptors in the central nervous system to decrease pain. It alters the response to painful stimuli. I would assess for the pain. I would watch the respirations. If they're lower than 10, I wouldn't give this, because an opioid can slow down the respirations. Labs, it could increase the plasma and lipase concentrates. Side effects would be confusion, sedation, hypotension, constipation, nausea, vomiting. Serious side effects would be anaphylaxis and seizures. I would be using my 3cc needle here, and I would also be using my blunt here to draw up my solution. I would be checking, so say if I was using my Demerol, I would be checking my solution, my medication with the MAR, to make sure that it was Demerol that I would be giving 100 milligrams. I would first, let's see here, I would be checking my medication to make sure that it was sealed and intact, that the syringe package would have been sealed and intact also, and also my blunt was sealed and intact. And I can use my 22 gauge needle, since it is a thinner solution. I'll start off with washing my hands. And then applying gloves. And then to start off with, I will clean off my medication for 30 seconds. Close it back. I would then clean my site for 30 seconds. would open up my needle. It'll leave a nice little sterile area here, and I will disconnect my needle from my syringe here so I can attach the blunt. So now I'll open that and attach it to my syringe. Then I'll do my second check of my Demerol. Make sure it's my Demerol and compare it. And I will draw it up, and instead of, so I keep my solution sterile, I'll draw it up again from my water. I'll pull back 100 milligrams. My needle. Push air in, draw back. And then I will make sure all the bubbles are out. While it was still in there, I would grab another nurse, and she would do a check for me with it being the high risk drug. And I would recap it. And then I can dispose of my blunt needle and then attach my 22 gauge needle. So then I would have my clean side. I'm going to loosen the cap up on here. So I'd have my clean side here. I would do a Z-track method, which holds the skin over, and then when I let go, it will keep the medication from coming back up of the injection site. I'll pull off the cap. Before I would actually pull, I'll do my third check is my Demerol, 100 milligrams for pain. And then, so I will insert my medication straight in. So I have my Z-track pulled over. I will hold it in the needle. I'll aspirate to make sure that I'm not into a vein getting blood. If there's no blood, I will go slowly, 10 seconds per milliliter. And then I can hold it in there for 10 seconds also. Pull out the needle and then pull back. I'll put gauze on there and put the safety on. I would move my hands so that the skin goes back over to, so my medication doesn't come back out. My 5 rights are right dose, right patient, right medication, right route, and right time. And then I would document and dispose of all of my needles into a needle box. And then I would ask the patient if they needed anything else, and I would document.